Hey everyone, it's Luke Gordon here, and today's topic is about total knee replacement surgery and how to know when you're ready to have surgery. So I've been speaking with some different people just in the last few weeks who are calling me and asking me questions about how to prepare for surgery because I've got some videos about that. But really, a lot of them are trying to either avoid surgery or they just don't know when are they going to be ready. And oftentimes, what you'll hear from the surgeon, if you've gone to consult with a surgeon that does total knee replacement surgery, is they'll say, "Well, just wait as long as you can, and then when you can't stand the pain any longer, then you'll know you're ready for surgery." And so that's a really difficult, I think, solution for a lot of people. And the reason being is because, of course, we all have different pain tolerances, and then your activity level is largely determined by how much knee pain you have. So to me, that's not really a very clear answer for most people, and potentially that's going to lead you into some trouble. So I'm going to answer the question for you in terms of what I typically tell people when they ask me that, and how they're really going to make a good decision to know when they're ready to have their knee replaced. So obviously, you might be trying to avoid your knee replacement surgery, but again, at some point, you're going to reach a threshold when it's the right time for you. If you have bone-on-bone arthritis and you've tried other treatments and things like that, and it's not going to get any better. So basically, what I've been telling people is that yes, you do want to wait as long as possible, especially if you're in the younger crowd. Both the folks I just talked to this last week were like 50s, maybe 60. So they're young for a total knee replacement. But what you don't want to do is you don't want to wait so long that you're not able to do anything. So, you've been dealing with the agony and now you can hardly walk. You're not able to do things you like to do, like if you like to go out for walks with your spouse or walk your dog, or maybe you're a little more active and you like to hike or bike and things like that. So it's that fine balance of saying, okay, you do want to wait until you're absolutely sure you need it, but don't wait so long that you're absolutely miserable and you're now dealing with like depression and anxiety because you can't do anything you want to do. So that's, I think, the big component I've been telling people. Don't wait so long that you can't do anything and you're absolutely miserable in that regards, in terms of like your mental well-being. But then also, if you wait and you're really tough and you've got a high pain tolerance and you can wait, potentially by the time you go in for surgery, you've been sitting in your easy chair for 3-4 months, and now you have horrible muscle tone, you've got horrible muscle mass, and what you've done is you've dug yourself a huge hole for the recovery process after surgery. So don't shoot yourself in the foot in that regards either, because again, you don't want to wait so long that you don't have good strength. If you've seen any of the videos I've done about how to prepare for surgery, the big message there is that the more strength that you go into surgery with, especially in those quad muscles which are on the front of your thigh, those are the ones that are most involved with your knee surgery. If you can go into surgery with really good quad strength, your recovery is much, much easier after surgery. It's quicker. Statistically, you're going to spend fewer days in the hospital and or like a skilled nursing facility before you go home. So there's so much that goes into the front end leading up to a total knee replacement surgery that you can do to optimize your recovery. So again, this video isn't really about that. I've got some other videos which I'll loop onto the end here. But again, if you're kind of in that zone where you're saying, yeah, I know I'm going to need one, I've tried all my other options, I did PT, I've maybe had injections usually, it's bone on the x-ray, there's not much else I can do. Maybe you've even made some positive changes to your exercise routine, or even gone the route of diet and tried to cut down some of the inflammatory foods and sugars and processed foods, which is great, by the way. So if you know it's coming and you're just trying to pick the time, take those things into consideration. So again, don't wait so long that you're missing out on a lot of activities that you enjoy, and that's having a negative impact on all aspects of your life, including your emotional well-being and your social well-being. And then also, don't wait so long that by the time you get to surgery that your entire leg is just completely weak, because then you're having a really uphill battle after your surgery and the recovery process. So I hope that helps you make the decision on the timing of your total knee replacement surgery. It's a little different for everybody. Again, the younger active crowd probably wants to have it done a little bit sooner and just get it over with. I'm talking to people right now, and it's snowing outside my window right now, actually, But they're talking about wanting to ski this season, because they're younger, and you can ski with a total knee. At least some surgeons will let you, and depending on who you are, you can decide for yourself. But so the timing is important to a lot of people. So again, just take all those pieces of information into consideration when you're trying to pick the timing for your knee replacement surgery. Any questions? Obviously, I'm happy to answer those. Just leave me a question or comment below the video. I'm going to link some of my other total knee replacement videos at the end of this one. And while you're here, if you would, I would appreciate a thumbs up and subscribe to my channel if you like what you see and want me to put out some more stuff. So that's it for today. Thanks for watching.